final presentation is by Dr. Lilian Wong and Paul Wong. The focus will be on meaning-centered approach to supervision, a mentoring model. Let me tell you a little bit about our speakers. Dr. Paul Wong is a clinical psychologist, professor emeritus of Trent University and Trinity Western University. He's a fellow of APA, APS, CPA, and the founding president of the International Network on Personal Meaning and the Meaning-Centered Counseling Institute. He is editor-in-chief of the International Journal of Existential Positive Psychology and consulting editor of the Journal of Humanistic Psychology. Dr. Lilian Wong, she was the associate professor and school counseling coordinator of the graduate program in counseling psychology at Trinity Western University and associate professor of psychology at Tyndale University. She served as psychoeducational consultant and school psychologist for several school boards in Ontario and British Columbia. Dr. Wong is internationally recognized for research on multicultural competencies in clinical supervision.
Thank you, Grandma. In the last few years, there have been tremendous changes in the world. And I'm from Toronto, Ontario, and our society has been really multicultural. We have so many people from different countries and coming in. And it is very difficult, isn't it? When you come into a new country from all over the place. And so there is such an increase in needs for mental and social support. And that means, how are you going to get those to fulfill the needs for the help? Yes, we have registered psychotherapists, we have clinical psychologists, and we have all this, but nobody can handle the multicultural aspect of it. And so what are we going to do? So we're going to start, have to train more people to meet the needs. Now, how do we prepare psychotherapists and counselors to meet the needs? So this is why Paul and I started to build something, we call it the mentoring aspect of it. Okay? Okay, let me double check how I do this. Okay, here we go. Now, this is what I'm going to be in 15 minutes. So, what is the difference between clinical supervision and mentoring? And what is the servant leadership model of mentoring? And what are some of the challenges of mentoring? And what are some of the new developments in clinical supervision? And I know there's a lot. And I printed out some of the summary. So if anybody who wants it, well, you'll have a copy. And if you wanted to, email us, and we could just send it to you. Okay? And we just make a very quick introduction here. What is the difference between clinical supervision and mentoring? And we talk about supervision. The previous speakers had already elaborated, and we know what supervision involved. And most of the time, when I was in the graduate program, and this, I had, for my dissertation, I had a supervisor from hell. She couldn't care less what I do. She would criticize this and that with no reason. Now, how did she get to be a supervisor? Because there was no training, right? And so this is why it's so important you know who you are, what you are supposed to be doing. So yes, supervision, you must know what are the basic things that you need to know, what is counseling, what's psychotherapy and all this, and then making decisions and train the skills to how to help people out of the rut, right? But as a supervisor, you have to know your supervisee. She doesn't even care about who I am. Well, of course, being, Chinese, so they don't even care about difference in cultural background, right? And they just do whatever they're supposed to be doing. So this is very, very difficult. So as a supervisor, you really need to know what your roles are and what you are looking at. And you give support, and you train them skills, and you evaluate. Of course, you have to evaluate, right? But it is so important to be a mentor. What is a mentor? Now, there are already many models of supervision. We heard so many of them. And then there are supervision, normally assign a supervisee, and you have to manage it. You have to be, report, and you have to mark them. But then you also have mentoring. That means. Now, how could you be a mentor? If somebody do not like you, would you like to be a mentee? It is very hard. But then, you know what? If you are a psychotherapist, and if you wanted to help the next generation, your personality would be very, very different from a teacher or someone who gives you a mark. You really have to have the insight to care about the person. And you must have a person that has been, wanting to help others to grow, and you learn how to empower people. And so it's not that easy to be a mentor. All right, so there's a coaching model of supervision, okay? You coach them, what to do, what not to do, and that's important. Skills are very, very important. But you also need to know, okay, you have to see what they are doing and see what they can improve on, and those are the things in supervision, right? But you also say, I always say, who you are is more important than what you say. I told my supervisors, you can say all you want, but there are a lot of things that are not verbal. They are observing you. The same thing when you are doing counseling, right? A lot of the things that your client will tell you, and you think about it with your ears, but your eyes are actually seeing how your client is behaving. A lot of non-verbal actions speak a lot louder than what it is. And this is why during the pandemic, we did a lot of, virtual. And virtual counseling, you only hear what they're saying. You miss the part that they're not saying, which is very important. How they sit, how they feel. Those are the things to do. So if you are a supervisor, you're working with a supervisee, a lot of things that the supervisor tells you, but there are a lot of things that they don't tell you. But if you're a good supervisor, it's really hard to be a supervisor because you have to evaluate your supervisee's performance. You have to make sure that they are going out there, they would be, licensed, they will be registered, and those are the things they must have. But then you also have to see what kind of person it is. Are they really ready to be, helping other people? So as a supervisor, you also need to be a mentor. A mentor means that I want you to do the best you can, but I cannot change who you are. I do not want to reproduce you as me, right? We are all individualized. We all have our own background, our own gifts, and our own strengths, and our own, weaknesses. As a mentor, you got to see your supervisee as a person with what I always say, physical, emotional, social, and spiritual. We are so many, we are very complex. So as a supervisor, you really need to be a mentor to see, I want to improve your gifts. I want to see the things, the area that you might need to change. And you want to see how I can see where you're going from here on in. Because I want to see my supervisees develop into somebody who is just beyond what they expect, but if they have those gifts within themselves. So therefore, the coaching and the mentoring and the supervision all in one. Now, my husband developed what they call the servant leadership, the model of mentoring. There are already a lot of development in this, so I don't think we have time to go through too many of those, but my husband was going to say something about that, okay? All right. Servant leadership. The growth and development of people is the highest calling of a leader. That is John Maxwell. Okay. The calling of a servant leader. We value people. We value people for who they are. And they are committed to. Okay. I don't know why I'm just finding all six. The servant leaders do not promote themselves. They put other people first. And they listen receptively and not judgmentally. In other words, you just allow people to say what they want to say. And also, they have to be trusted because they are authentic, they're dependable. In other words, the quality of the person is very important. And then they have, the purpose in other people in their hearts. So they display kindness, concern for others. The servant leader truly care for the people they serve. Does it make sense? Yes. Paul Wong developed this self-transcendent model of servant leadership and good work. Self-transcendent model focuses on rising above and integrating the bright and dark side of self and others as two sides of the same coin. Without accepting these basic premises, it's difficult to practice servant leadership. And I know this is just the term to you, but if you go to the website, you're going to have a lot. All right. And this is the research they have done. So there are factors that empowering and developing others. Okay, deserving others and inspiring leadership. And you have visionary leadership and courageous leadership. Okay? Now there are a lot of challenges in mentoring. Paul, you want to come and speak? Paul, you want to come and speak on this? No? It's hard just to rush through this, you know. All right. Okay, there is the Chinese concept of mentoring. Okay, you know, I'm kind of hesitant because I'm not very good in Chinese. Okay, both my parents were born in Toronto. And in Chinese, they call it 师傅. That means it is it's a mentor, but it's almost like a father. Okay, so as a mentor, you're not just teaching them what to do, but you just want them to develop the best they can, like a father to the son. Does it make sense?
Yes.
All right. Well, the first challenge is the student is not above his teacher, nor the servant above his master. As a mentor must have competence, then a mentee. In other words, being a mentor, you're constantly learning something new. Especially, you know, nowadays with AI, and with multicultural, competence, we really need to learn so much more. So as a mentor, you constantly need to learn. And also the mentor need to demonstrate what they can do, not just in the talks, but actually working through. And so your mentees will understand, aha, this is how you do it. Not only, you've got the skills, but they also respect you, who you are. And this is something that this in Tai Chi, and you have to demonstrate that you do have the power. Now here's a photo, and this lady is supposed to have the Tai Chi power, and she demonstrates whenever she does it, and you just push, the guy just jump out. I don't know. Is that real? So this is what she demonstrates, how she can easily push the follower, according to what she said. All right, cross-cultural competence. Whew. The mentor must have cross-cultural competence. What we did was a multicultural counseling and multicultural supervision. And this is the thing that I always like to research and I like to talk about. So you need to be aware of the client's worldview, right? When you go to see the client, you want to see what their worldview is. But in supervision, you have more than, you are supervising your supervisee, so your supervisee will have to understand the client's worldview. And so in other words, in multicultural supervised counseling, it is important, but also when you are supervising, when you're in multicultural supervision, you added that extra. You know the supervisee and the client's worldview, and that is very important. And also the skills, you need to how to do both. Anyways, I think we could just move on. I don't know why I'm so nervous here. When I'm just talking about multicultural, it is so important we understand where they're coming from. But not only where they're coming from, how they are interacting with the new environment. Because we have so many people coming from a different country. And if they come in for counseling, and your supervisee sees someone who is different from them in their worldview, in their knowledge, in their practice. It is very difficult for the supervisee to try to help the client grow and fit into the society. So you are the supervisor, try to help the supervisee, and what can you do? You look at the supervisee and you say, okay, I know you, but you've been with me, I know who you are. But now you have a client that is different from where you are. So as a supervisor, you not only put in, your supervisee's cultural background, but you also need to understand how the supervisee looking at the client's background. So it's not easy to be a supervisor. When one of my lab, I had 5 rooms with training 5 supervisees, okay? And I'm in my room with the videos, and all of a sudden, the 5th room, my supervisee came out in tears. She opened the door and she was just sitting there and crying. Of course, I ran over to see what's happening. So I went into her, and she said, I cannot hold it, my client said something, and it really hurt me, and I feel so sorry for her. You see, so in other words, it doesn't matter whether you're a supervisee or supervisor, you are a human being. You have the feelings, and you also know how say, I'm supposed to help them. How could I help them? So you have to control your emotions, right? So I told her, I said, it's okay, I understand who you are. But later on, I have to teach her how to control her emotions aside as a human being, but as a counselor. You got to learn how to control your emotions. So this is the kind of thing that we as supervisors, training supervisees, and the supervisees looking at clients, it's very complex, isn't it? It asks a lot of us. So I told her, I'll come in with you. So I walked in with her and with the client, and she's sobbing. The client was crying, and then we're going to sort it out. And afterwards she said, I learned so much. Just to demonstrate. It's so important, supervisors. It's not just in words, it's not in paper. You got to feel it. You got to know how to do it. But we don't know everything, right? So we learn along the way. So supervisors need to learn, especially now. I find it in ours in Toronto, very, very multicultural. And it's very, very difficult in, different economic situations. And if how your supervisee meeting with their clients, and then you have to learn more. So in other words, it's not easy to be a supervisor. We need to open up. We need to experience it. But we need to withdraw ourselves to say, what am I supposed to do here? And this is why it's so important. You must have a model. What kind of model do I follow? We learn in our textbooks, in our graduate programs, all that, but it doesn't fit anymore. So what we're going to do is, and my husband loves this one. How many people know this article? No? Yeah? Okay, I'm going to have him do it. No, it's optimal conceptual theory, and it's about multicultural. Yeah. Okay. I'm going to move forward, okay? Okay. In our paper on what helps and what hinders cross-cultural supervision, the critical incidents, the most important factor for helpful supervision is personal attributes. of the supervisor. And in our course on the safe and effective use of self in psychotherapy, for psychotherapists, the conclusion is still the same. The supervisor attributes is very important. And therefore we emphasize the most important, but least understood, the process of cross-cultural supervision by osmosis. What is osmosis? Osmosis here is gradual, unconscious assimilation of supervisory characteristics and skill. As I said, who you are is more important than what you say. So, effective supervision depends on the quality of the supervisor as a person in terms of character, attitude, kindness, empathy, and fairness. And it is important for us to engage in self-reflection and self-cultivation to become a decent human being. Does that make sense? Yes. That means that we really have to be open. So often, when we see our supervisees, we think that we are the supervisor, and I need to know everything. No, see, I am just as learning. I am so open. You can teach me too, right? And that's how we grow, how we broaden ourselves, and how we interact. And you know what? I just observed. Most of us here are females. How many males here? 3? 4? Right. Now, what are we gonna do when we have supervisees who are males? So we have to learn from them, don't we? From their perspective, how do we work with clients? Now we have more and more male clients coming in, and even teenagers, and even, it's very, very difficult, isn't it? And a lot of phone calls that we got at the end of the third year of pandemic, and people called up and said, I am very anxious, I am lonely, and I don't know what to do. I told them, I said, you know what? If you don't feel lonely, you don't feel anxious, the last couple of years, you're not normal. When you normalize it, they say, oh, I am not the only one who is a dum-dum, right? But we can work together. We will come together, work. It's amazing. I have a 14-year-old boy came in. Gifted kids, and he was looking for a good university to go to. He was in grade 10. He was looking for the university. He's bright, but he said, you know what? There's no use to live. This world is hopeless. What am I doing for? So they got addicted to what? The iPhone. Yeah. The first thing he said, okay, I could get you out of the addiction first, and then let's move forward. Within 4 weeks, now he came back and said, I focus most of the time doing my homework, and I'm looking forward to it. So in other words, don't be discouraged. You are a psychotherapist. You change people's lives, and that's worth all the learning. And then you are the supervisor. You're going to teach the supervisees according to what you have learned, you pass on to them, right? Because we have to admit that we are all different. But we have to learn how to enter into other people's lives to see where they should be going to. You know, so often, supervision, as I told you, I had a supervisor from hell, right? So, if I follow her, I'll probably get rid of psychotherapy. Yeah, you have to be who you are, understand who they are, where they're going. And this is so important. We value individual lives. And we also encourage them to develop the gifts that God has given them. And also, it's okay to be different. Now, anybody want it? I'll tell you what, I'll leave them here. And you know what? Paul and I did this picture book. It's called, Inspiration for Difficult Times. And inside, people don't like to read too much, right? Paul had over 6,000 people in Facebook, everything else. And so he had written, and they requested, could you put them all in the book? So we grabbed them in the book, and with all the photos and everything else, here's when we were in Moscow with Viktor Frankl's, what would they call it? Viktor Frankl's Institute or something. We were there for the opening, and that was the picture that we took. So we have all these pictures, books, and everything else, and now they all wanted, because they wanted to read and they wanted to feel that other people do have problems, but we could be encouraged. So we really feel good. So you can do something. You've never done it before, do it. Be creative. You see? I mean, it took me a long time because I'm very compulsive and I'm perfectionist, and I'm a copy editor, a professional copy editor. Even the comma, nowadays people don't care about comma, and people don't know what is a colon, what's a semicolon, what's the difference with that. I mean, we were stuck with that, right? But with the modern society, you don't spell anymore. So be creative, okay? And then as long as you reach out to other people, it doesn't matter what needs you do. Thank you for your time.